Hello, it is Wednesday, September 9th, and yet again, time seems to be whizzing by. It's been a great weekend. I had a fantastic Labor Day weekend. I went to the beach, ran on the beach, swam in the water, went hang gliding, enjoyed every bit of the ocean and beach. Just trying to enjoy as many of these moments as I possibly can, knowing that I have, a limited number of days before my surgery. I'm feeling really good, positive. I do have my moments, where I think I get a bit apprehensive, but more around the planning and logistics of being in the hospital for, a couple of weeks, taking care of the house, figuring out Lorenzo care, and all that stuff is a little bit stressful. But overall, I'm feeling more and more comfortable with the decision that I made. I also am feeling so fortunate to have such incredible people in my life who have, been reaching out to me, offering assistance to help me through this. And I am just blown away and very emotional that I have so many people that are just so freaking kind and good and generous, who are giving so much. And as I've shared with you before, it's so hard for me to receive. I'm usually very capable, so I have kind of let go of that, knowing that I need a lot of help. And it's been very touching to have such a tremendous group of friends and family stepping in, offering help. I have peace of mind that when I'm in the hospital, everything will be looked after, especially Enzo. So it's pretty incredible and fantastic. I am pretty much just gearing up mentally, emotionally, and physically to prepare for the surgery. I want to be in the best health going into it. I feel strong. I want my body to be strong. I want my mind to be solid, and I want my heart to be, ready for the most positive outcome. And just practicing, what I've been doing over the past few months, maintaining kind of this structure of gratitude, meditation, yoga, exercise, eating well, and really just enjoying the moment and finding happiness and joy and trying to stay within that space. I've got about 2 weeks. They pushed out the surgery to September 26th, so I've got about 2 weeks now to prepare. It gives me plenty of time to organize to every detail that I possibly can to make it easier for everyone, looking after Enzo and taking care of the animals in the house. I also am continuing on with integrative medicine at Vitality Health and Wellness. I'm doing some ozone therapy and injections of high-dose vitamin C. I'm also taking a lot of different herbs and vitamins that are supposed to help my boost my immune system, so that I'm in a really good place going into the surgery. I'm not gonna lie, my veins are pretty bad from the chemo, so it's a bit of a daunting task to get anything administered intravenously, so it's been a bit of a struggle. Yesterday they had to poke me, looking at my arms, maybe 8 or 9 times to finally get a vein catheter in. But it was worth it, and I think the vitamins, really are beneficial to keep me well and to keep my body strong. I also decided to reach out to one of Dr. Sang's patients. I haven't spoken to her yet. She's 3 weeks post-surgery now, and Dr. Seng had offered to get me connected with her just to learn a little bit more about her experience, to have an opportunity to ask more questions about the surgical procedure, the experience and all of that. I think really to put my mind at ease. And I decided finally, yeah, of course it would be a great idea. You know, I've been able to access textbook information on the internet about the procedure itself and all of the details. Surgery is complicated, I think, and it's a very large surgery. The procedure actually takes, Dr. Seng told me 12 hours, and I went, what? I think that scares me, that I'm going to be out and under for 12 hours. But there is some protocol. They're going to, put me under, and they'll do a check and an immediate biopsy on some of the surrounding lymph nodes, just to make sure that there isn't any cancer present before they even green light. So I'll maintain being under. They'll do a biopsy right then and there, the lab standing by, and then they'll get a green light to move forward with the surgery. And then the surgery will be done in 2 phases. I think the initial phase is obviously removing the pelvic organs, which entails all of the bladder and then also the large intestines, the colon, rectum, and anus. And I've already had a full hysterectomy, so everything else, the tumor site, everything else will be taken out. And then the second phase of the surgery, I think, is the reconstructive rewiring, repiping me, and then obviously stitching up and all that. So it's a big surgery. I'm feeling good about it. There is no doubt in my mind that, I want to do this and that I'm ready to do this. It is a little bit scary, but I think that's why, it would probably serve me to hear one of Dr. Seng's patients' experience, so that I can equip myself and think about things maybe that I haven't really thought of as of yet. I also want to connect with her and wish her well. I think her scenario, is very similar to mine. As Dr. Seng was saying, it's almost identical. She's just a couple years older than me, and her cancer was not detected like mine, and she had a botched hysterectomy like me, and went through treatment, aggressive treatment, much like I did, only to have her cancer return. And interestingly enough, her type of cancer is also identical to mine. There is most cervical cancer is HPV related. Mine is a gastric type cancer. It's a mutated, I don't know, it's a genetic mutation, and she also has that type. So again, there's a lot of similarities, and I would love to just hear her experience and also just connect with her and wish her well, and maybe I'll offer her, just my prayers and a speedy recovery, and give her hope. I'm sure, from what Dr. Seng tells me, she's a rock star, and she's, within 2 weeks she was already standing up and, starting to walk, which is incredible. So that gives me quite a bit of hope, and I think it would be fantastic for me to reach out to her. So I'm looking forward to that. For the most part, I'm going to just continue on. I've got a couple of consults on the calendar with plastic surgeon, also with a urologist, just to talk about a different option for after they remove my gallbladder, just what the opportunities are in terms of having, I guess, a bag or a straw to eliminate urine. So there are some choices that I will have to make. I think the criteria for me is obviously to lessen any complications and to facilitate a smooth and fast recovery is really key, and also maintain, quality of life afterwards. Some of the things that I've been thinking, which it's kind of funny, but I was thinking about clothes. I don't know where these, what kind of clothes am I going to be able to wear, knowing that depending on where the the bags are located. I'm not quite sure if I can, and where the pouches are, how to be able to accommodate, you know, that. I think I'm gonna bring back the muumuu. That's my thought. I'm gonna rock a muumuu and try to be as comfortable as I possibly can. But yes, these are some of the questions that go through my head. I know it's silly, but anyway. Every day has been a blessing. I have really been maintaining my practice of gratitude, meditation, and yoga, and eating well, and taking care of myself, and opening up my heart, and finding happiness within each day, and really letting go of some of the fear, moving through it, and focusing in more on hope and a positive outcome, because I think those are the things that will serve me better in my recovery. I just wanted to say thank you to everybody that has reached out, and I don't know, it's so hard for me to say, you know, it's just like thank you. Thank you's not enough. Since this journey started for me over a couple of years ago, you know, I'm just blown away by the amount of generosity and kindness, and I am very blessed. I have many angels who have just come through and been there for me and Lorenzo, from my colleagues at work, my family, my friends, strangers, even, you know, I'm just so lucky, and I think I'm in very good hands, and I'm looking forward to the surgery. I wish it could be sooner than later. I am enjoying every day that I can leading up to the surgery here, but I almost am more eager to have the procedure done so I can get on the road to recovery. So these days will be focused in on enjoying, also, you know, making sure that everything goes off without a hitch, and just preparing my mind, heart, body for the best possible outcome. Thank you again for all the love and support. I hope everybody is well, and I'll talk to you soon. Onwards.